This program on investing under regulation crowdfunding is not investment advice.
Rising with the crowd, power unbound, change makers lead where hope is found. Superpowers for good, shaping the fate. Investors and dreamers open the gate. Supercross stands loud, proud and true, building tomorrow for me and you.
Have you ever felt like the medical health, that especially mental health care that you or your friends and family may receive is either hard to access or inadequate when it's received? I think, join the crowd. A lot of people think that's a problem in our country. Well, today's guest is working on a key solution that you can participate in and profit from. So stick around. You do not want to miss this episode. Now, welcome to the Super Crowd Presents Superpowers for Good. I'm your host, Devin Thorpe, and we're in the middle of Power Up October. I invite you to check out Power Up October at Superpowers for Good at our website and see how you can engage more powerfully with us to support the good that we do at Superpowers for Good. Now, let me introduce you to our guest today. Jacques Jospitre is the co-founder and CEO of SohoMD, which is a company that is delivering a more holistic but very doctor-centered medical care for mental health. This is really an exciting development. I am really genuinely excited about what this means. Dr. Jospitre, welcome. We're thrilled to have you on the show.
Devin, thank you so much for having me here today.
Well, we're really thrilled by seeing what you're doing. I think it's fair to say that there is a problem in access and also the very nature, that the sort of incomplete nature of most mental health care in the United States. Is that what you're seeing?
Yeah, absolutely. I think you hit it on the head. And it's such an important issue where people are suffering. They're suffering. They're going to doctors. They're going to therapists. They're going to psychiatrists. And they don't always feel like they're getting better. And that's what makes it so frustrating. So it's one thing to have the problem. It's another thing when it's so difficult to really get treatment and get solutions where you start feeling better. And a lot of it has to do, and I think that the message, even broader than SohoMD, is I think in the healthcare system that the financial forces that have shaped the care that we see today have made it very fragmented and not as effective as it could be. Where doctors, like when you go to the primary care doctor, you have very little time. You're in, you're out. They do a quick check of your lungs. They just do a quick evaluation, and they see you, for your next annual visit. And also, when you go to a psychiatrist, they go through a list of symptoms, and they say, okay, based on all the things you told me, I've just gone through this checklist, and this is your diagnosis, and here's your prescription for this medication, and I'll see you in 2 weeks. And that approach to care, which is modern medicine, doesn't always get to the root cause of the problem, which is why I think people find themselves not getting better. And if you take a step back and really approach things clinically, which is really the underlying message that I want to share with the audience and talk about, how we approach the care. If you approach things clinically where patients come in, you do the symptoms, but you do a very thorough evaluation of what are all the things in the differential, meaning what are all the causes of those particular symptoms. When you dig deep, you get to some root problems, and more importantly, you get to some real solutions to help patients feel better.
It really is. I think a huge problem in the country. So you're really hitting it on the, kind of the nail right on the head. And it's interesting, the business you're building, the practice you're building is no longer a neighborhood operation in Soho, right?
Yeah.
This is
It's expanded.
You're operating in 20 states.
Yeah.
Give us a sense of what the marketplace is now telling you about how you're getting it right.
Yeah, one of the things that we've seen over the years is that patients, when they come in for their first visit at SohoMD, they come back at least 12 to 13 times. which is multiples higher than other practices. And a lot of that has to do with the fact that we do these thorough workups. We really try to understand what's going on with patients clinically. It's not just what are your psych symptoms, but what are nutritional issues, what are endocrine issues that are driving your psychiatric symptoms. And from that additional information, it helps us really create these very effective treatment plans for patients that get them better. And on the talk therapy side, we also try to look at what are the past traumas that people might have that are really kind of keeping them stuck, and then having our therapists really provide care that address those mental health issues at the root from the talk therapy perspective to help patients get better, so that you don't find yourself in a therapy session where you're coming in, you're talking, and you don't feel like you're making progress. You're not even sure what you're talking about, and you return week after week, and you don't feel like it's worthwhile. That's what we tried to change here. We really said, we took a step back and we said, how could you approach therapy in a way that the patient could also make that same progress that we're doing on the prescribing side? And we shaped that perspective for both the prescribing and the talk therapy side, which is what makes our model of care so effective.
I love this holistic approach that you've got, trying to get to those root causes. And as I, think about that, you're testing for things like inflammation and hormones, and it really is a much more holistic approach. And if I hear you right, if I understand correctly, you're still using, all the modern medicine
Yeah.
tools, but you're complementing this search for underlying root causes. How does that all blend together? I know some people are a little skeptical of alternative or holistic medicine, but it seems to me to make perfect sense here. What are
Yeah.
you seeing?
Yeah, absolutely. So we're doing additional tests. So we're increasing the resolution of the clinical information that we're looking at in terms of making an evaluation. For example, I can have a patient come in. I could go through the DSM questions and find out that they're depressed, and I could write for an SSRI medication, and that could be it. But I would also send that patient to get labs where I'm looking at different vitamins. I'm looking at different hormones. So, for example, if you're very deficient on B vitamins, D vitamins, just the series of vitamins that help you produce your neurotransmitters, there are clear findings between deficiencies there and having mood issues. Or, for example, if your thyroid is dysfunctional, where you're hypothyroidism, one of the presenting symptoms can be look just like major depression. But if I don't do a deep dive in looking at your thyroid gland, that could be missed, where you're getting an SSRI like Prozac, and instead of getting thyroid replacement from an endocrine perspective. And so we're doing the DSM, we're writing for medications, great medications. The psychiatric medications are wonderful, they're very effective, but it's within the context of all that other information that we also evaluate. And from doing that, we're able to get the patients who need the thyroid hormone replacement, that treatment, patients who need the vitamins, those proper vitamins, and the patients who still need Prozac, they'll get that too, while most other practices are not covering all those domains.
Yeah. Now, you've got some data, right? You've been at this a while. What proportion of your patients are receiving the conventional SSRI treatments compared to other practices? Do you have a sense of how different your practice really is on the ground when fully implemented?
Yeah, the big difference is that patients who are seen to be thought to be treatment resistant. So treatment resistance means I gave you a prescription for a medication and you're not getting better. So a good portion of those patients, the majority of those patients, we're finding that they have other issues going on, that their vitamin D is extremely low, that they're deficient in these B vitamins, that they have, or they're having these hormone issues. That a good portion of the people who are thought to be these treatment resistant cases, when you actually do a more thorough workup, you find the cause. So they're treatment resistant to medication alone, but they're responsive to care when you add in these other pieces. And some of them stay with us, but some of them don't even need to stay in psychiatric care. Some of them might need an endocrinologist and they'll go off to care in endocrinology. Some of them might need B12 shots and they'll follow up with the primary care doctor to get that shot. So we identify what is really causing their presentation, and then either they'll stay with us, but we'll collaborate with the other providers to make sure they're getting the care that they need to get better. And so I think the key thing is those treatment resistant cases. This is an approach to care that helps people get better who are so frustrated and not feeling that they were improving, this is an approach to care that gets them better.
It's wonderful. And are you able to see any outcomes data that suggests that there is a difference by using your approach? Are you able to demonstrate you're
Yeah,
helping
I
more
think it was
people?
over 80% of people saw a significant improvement. So we do rating scales where we can see how depressed or anxious people are. So it was over 80% of people who were, in that resistant group, that we saw significant improvements in their scores, which is a pretty impressive result.
That is an impressive result. I don't think conventional treatments are getting anything like that 80% number. That's tremendous. Um, as you think about this tremendous success you've really had building this business, uh, you're now looking at trying to kind of reach an inflection point to scale this even faster. You've got a raise now on WeFunder. Tell us a little bit about what you are, why you decided to raise on WeFunder as opposed to other approaches you might use, and um, tell us what you can about it under the rules to be careful, but tell us
Yeah.
what you can.
A couple things. One of the reasons that healthcare has the problems it has today is because of financial forces. So people really going into the business where you try to optimize the clinical work around the money. When you do that, you come up with the system we have today, where if we just function on just trying to focus purely on just the financial outcome, meaning make as much money as possible, we would not have the clinical model that's so thorough and thoughtful in terms of treating patients. And so we wanted to be able to invite the community to be part of this process of growth for us, where we can keep the clinical focus at the heart and center of what we're doing, so that we're not driven by some financial force that we have to focus on that pure return to investment for people, where that's primary and the clinical goals are secondary. We wanted to make sure that we would have investors who really cared about mental health, where the clinical objective, the clinical goals of making sure that we help patients really achieve, true improvement, and having that be the biggest priority would always come first, and then the financial reward would come second. There's definitely financial reward, but it doesn't have to be the primary goal of a clinical company. And I think that's what happens when you have an organization that was created by doctors, by clinicians, where we went to medical school, we did all this training to really take care of people. That's what we have, gave years of our lives to really focus and study to really better others. And so in making a company, we want to extend that same philosophy and mission to the organization. And that's what's so compatible with the WeFunder process, with this crowdfunding process, where people who are investing in us do care about mental health. They've suffered from it themselves. They have family members who've suffered. They understand the pain of trying to get care for someone, desperately, and the system doesn't work. You're, trying to get people admitted or trying to get people to get better, and you do everything you can, but you're not able to achieve that. People who understand that pain, those are the people that we want really being part of this journey and mission with us, because we do have a solution that really has such a wonderful, powerful impact for patients. And that's a message that we'd like to A, expand to more people, but B, there's a way that we're thinking about how do you leverage AI to really enhance the work that we do. That we have this perspective, we built this whole model. It's very powerful, very, very effective. How do we now take the power of these intelligent agents and use it to take a clinician who may not be experienced in this approach to care and create something called a clinical decision support tool, meaning a tool that the clinician could use that helps them evaluate and come up with the best treatment plan for patients. That's really what we want to move to. That's where the whole industry is going. And I think because we've been such a leader in really focusing on clinical excellence, we really are well positioned to incorporate AI and really do something wonderful in the healthcare space.
Yeah, this is exciting stuff. Listen, Dr. Jospitre, we got to take a short break here, but we'll be back. Folks, I'm here today with Dr. Jacques Jospitre. He is the co-founder and CEO of SohoMD, a remarkable enterprise scaling rapidly, doing meaningful business across 20 states, trying to go fully national, raising capital on WeFunder now. Check it out at s4g.biz/SohoMD. We're going to shift gears when we come back after the break. We're going to talk to Dr. Jospitre about his superpower. You don't want to miss this. Stick around.
Download a free copy of How to Make Money with Impact Crowdfunding. The book Sarah Hanks describes as
a fantastic overview, not just of crowdfunding investing, but of investing in general.
Andrew Savickas raved,
"This book offers unparalleled insights for anyone looking to make a difference."
Scan the QR code to get your copy.
Save the date for Super Green Live, the global event on sustainability and green innovation, January 22nd through 24th, 2026. Struggling to raise capital for your business? Unlock the power of the crowd with AI. My free guide, Crowdfunding Made Simple, walks you through every step to success. Get funded smarter, faster. Scan the QR code now for your free download.
Welcome back, everyone. So excited to have you here today. We have with us Jacques Jospitre. He's the CEO and co-founder of SohoMD, a mental health practice that is scaling rapidly, making a tremendous difference using a more holistic approach to treat and address root causes with better outcomes. Very exciting stuff. We're going to shift gears now to talk to Dr. Jospitre about his superpower. Stick around. You don't want to miss this. Dr. Jospitre, you really have accomplished something truly extraordinary. I talk to a lot of founders who only ever get to dream about building a business that you've already built. And you have tremendous potential ahead of you. You know, the opportunity to create something truly magnificent. It's exciting. What is your superpower?
I think my superpower is taking things that are very complicated and simplifying them and taking action on it. So I think like connecting dots between different areas, different fields, and really being able to grasp different areas, read multiple textbooks and about different topics and kind of integrate it into this unified, cohesive process. I think that's been the superpower that I've been given, and that's what I've been applying to SohoMD is really thinking about like what are all the solutions that exist out there, like what are people doing just from every angle, from every perspective, and how do I turn it into something that we can implement day in and day out, and that's what I was gifted with. Like for example, when I was younger, I used to write software as a kid. Like those skills come in, they're useful, but it's not part of my day to day. I went to med school, went to business school. I did a couple of years of research in neuroscience. I went out and learned about functional medicine. I learned all these different things. So from each of these different experiences, I was able to distill what was useful in creating this unified approach to the care that we do. And so that's what I was gifted with.
You really have done an excellent job of bringing these, connecting the dots across disciplines, bringing these different ideas together in SohoMD. I wonder if you could go back in time, though, and think about another example that sort of predates that. I wonder, in your youth or early life, maybe as a medical student, can you think of a time when you were able to test out the early formation of that superpower and share kind of that story with us? Can you think of an example?
I think an example of that might be from my ability to connect with a wide range of people. I think my interest, I have so many different areas of interest that, and it's true, it's purely for the sake of learning more about this wonderful world that we're in. That really gave me the ability to really have a very diverse group of friends. So very early on, just people with different interests, different perspectives on the world. I've always been able to find ways to connect with a wide range of people. I have a very diverse group of friends, and I was always able to be a connector between people who would really they wouldn't connect directly, but because I was able to connect with each of them, I could serve as a bridge to help them communicate and get to know each other and learn from each other. So this notion of really of being flexible in terms of how we see the world, in terms of my ability to relate to people, and really I think just this universal caring about others and this perspective of empathy, because of my ability to really connect with such a wide range of people. I think that that's something that's helped me really focus on trying to be a force for good in the world, and really really being able to have real change at scale. So I think I did it on an individual level, where I was always someone who was supportive of others, or always try to really help people the way I could, or just use the best of what I was given to help make those around me better. I think that that's kind of what my life has been like from the beginning, and so that perspective, I think, lends itself into what I do today. And when you look at just I've had such great support from friends from so many different aspects of my life. It really is a testament to the connections and bonds I made with people over the years.
Yeah, that's a great example of how you've also used that superpower in connecting rather than ideas, but with people. Now, as you think about the skill set now as a CEO, part of what you do every day is in short bursts and informal settings, you're coaching people, training people, guiding people. How would you coach us to kind of try to develop that superpower a little bit in ourselves? Uh, I think everyone has their own superpower, and I'm glad that's the case. We can't all be like you exactly, but at the same time, it's a valuable skill. And some of
Mm-hmm.
us would want to enhance our ability to do that. Can you give us some coaching on how to be able to cross pollinate those ideas in our head, to connect ideas and people more thoughtfully, more strategically?
I think it's really spending time getting to know yourself. Things like meditation, exercise, yoga. I think even religion is a very powerful force for good for people. I think when you look at all the religions, there's some common themes across all of them in terms of really choosing the right path in terms of how you live your life. So I think really making an effort to really develop a connection to that inner wisdom that we all have. It's not just me, but even in the work that I do, when I was working a lot with patients in therapy, my goal was to connect them to that inner wisdom. It's not I am not the one who knew what was best for them, but if I could get them to connect with that inner voice, that inner wisdom, that's what would help them choose what was best for them in their own lives. So I think things that help people find that voice, connect to that voice, and really learn to trust it. I think that each of us has that. It's built in. It's part of the human, being human. Is we've all have that wisdom in us. It's really finding a path to it and really bringing it out to the world. And it makes your life better, and it also makes the life better for everyone who's around you.
Yeah, that's brilliant. Now, as we wrap up here, I want to invite you to take a moment and coach people on how they can invest, connect with you, become patients, right? What are the portals you got to go through to get into the program? And some people will want to follow you on social media. You're a big deal. They want to be able to gain from your wisdom that's shared publicly. Guide us.
Yeah, absolutely. So it's SohoMD is easy to find. So it's SohoMD.com for the main company. It's WeFunder.com/SohoMD for that WeFunder campaign. For me, I'm at Dr. Jospitre, Jospitre. So on different social media platforms. I'm happy to connect with people. They can reach out on LinkedIn or different platforms that I'm on. I'm happy to respond. If people have questions, happy to point them in the right direction. So reach out. I'm here.
Fantastic. Well, I really want to thank you for taking the time to
Uh,
be with us today. It's just been so exciting to learn more about what you're doing and the tremendous outcomes you're creating, the progress you're having in building your business. I want to join you in suggesting to people that they take a minute to go visit s4g.biz/SohoMD to learn more. That'll take you directly to the WeFunder page. Folks, I encourage you to check it out, learn more, figure out if this is an investment you want in your portfolio. But this is a really unusual opportunity to invest in a business that is so, making the incredible progress and yet still has so much potential. Um, Dr. Jospitre, we really want to wish you every success in the great work that you're doing.
Devin, thank you so much for having me here today. Really appreciate it.
All righty, now let's do some good.